So let's do a deep dive into the risk factors for compartment syndrome as well. Deep dive into the risk factors for compartment syndrome. Why will pressure build up in the muscle compartment? We saw how the muscle looks like. Okay, why will pressure build in it? There are various causes of pressure building in the muscle compartment. One of them is if there is something filling that space. So just think about, an enclosed space. Why will pressure build in it? So what are some of the things which can fill that space? There can be bleeding into that space. There can also be swelling of that space. Number two, there can be blocking of the blood flow. So for example, there can be an external thing which is blocking blood flow, like if you put a cast on and it is very tight. There can also be ischemia. And then there can also be burning of the tissues. So, if there's an external burn, which forms a circumferential burn, that can also do that. So when you're thinking about compartment syndrome, don't only think about it in the context of trauma. All right? Now, what are they? Severe trauma, long bones. So if you have a long bone fracture, say of the tibia or the forearm especially, there can be trouble. As well as crash injuries. Okay? And then if there's prolonged blood cut off, and then all of a sudden there's sudden return of the blood. So there's ischemia, and then for whatever reason, blood flow starts again. Realize that it causes what we call inflammatory swelling. So just think about patients who have post-op or patients who had a tourniquet placed very tightly, and all of a sudden that tourniquet is removed. Okay. And then another risk factor is in patients who are anticoagulated. So patients on warfarin, patients who have bleeding disorders, patients who have developed muscle tear or vascular injury, and patients who have developed burns and systemic inflammatory response syndrome, and even patients who are going through resuscitation and they are bombarded with so much fluid. These are all risk factors of compartment syndrome. There are other less common causes of compartment syndrome like myositis, myonecrosis,